Can maternal TSI affect a baby's thyroid health? Imagine a tiny baby growing inside the womb, with its future health quietly being shaped by what happens outside the baby's body. One important factor is maternal thyroid-stimulating immunoglobulins, or TSI, which are special antibodies produced in some cases of Graves' disease. These antibodies act like thyroid-stimulating hormone, which normally tells the thyroid gland to produce hormones. But because TSI can mimic this hormone, they can overstimulate the fetal thyroid gland when they cross the placenta during pregnancy. This crossing of TSI from mother to baby starts early in pregnancy, but the placenta becomes more permeable as pregnancy advances. Around 20 weeks of gestation, the fetal thyroid begins to respond to TSH and TSI, making the fetus vulnerable to their effects. When maternal TSI levels are high, they can cause the fetal thyroid to become overactive, leading to a condition called fetal thyrotoxicosis. This can show up as a rapid heartbeat, an enlarged thyroid gland called a goiter, slowed growth, and, in severe cases, even heart failure or fluid buildup in the fetus. After birth, the baby may also show signs of hyperthyroidism, such as irritability, difficulty gaining weight, and a fast heartbeat. The risk of a newborn developing thyroid problems depends on how high the mother's TSI levels are. Usually, if TSI levels are more than 2.5 times the normal amount, the chance of neonatal hyperthyroidism increases. Not every baby born to a mother with Graves' disease will have thyroid issues, but the risk is there, especially if the mother's disease is active or her TSI levels are high. If a mother is treated with antithyroid medications during pregnancy, the risk of fetal hyperthyroidism can be reduced. These medications cross the placenta and help keep the fetal thyroid hormones in check. However, if the mother has had radioactive iodine treatment or a thyroidectomy and still has high TSI levels, the risk of fetal thyroid overstimulation remains because the antibodies continue circulating in her blood. Interestingly, in some cases, the high levels of thyroid hormones caused by maternal TSI can suppress the fetal thyroid's own production, leading to a condition called central hypothyroidism after birth. This means the baby's brain and pituitary gland might not produce enough thyroid hormones, which requires careful long-term monitoring and treatment. To keep an eye on this, doctors recommend measuring maternal TSI levels early in pregnancy and again, around 18 to 22 weeks. Ultrasound scans can also help monitor the fetal thyroid size and heart rate, giving clues about whether the fetus is experiencing hyperthyroidism. This careful monitoring helps ensure that, if the baby shows signs of thyroid imbalance, appropriate treatment can be started promptly. In summary, maternal TSI can indeed influence a baby's thyroid health by crossing the placenta and overstimulating the fetal thyroid gland. This can lead to hyperthyroidism in the fetus and newborn, but with proper medical care and monitoring, these risks can be managed effectively. If you are pregnant and have Graves' disease or high TSI levels, it's essential to work closely with your healthcare team to keep both you and your baby healthy. Always remember, individual cases vary, so personalized medical advice is key to navigating thyroid health during pregnancy.